Next up, please welcome Wellth, presenting are Alec Zoff and Mike Fusillo. Take it away.
Thank you. Hi, I'm Alec Zoff, CTO and co-founder of Wellth. And at Wellth, we want people to get paid to take better care of themselves. My co-founder and I started Wellth to address the $500 billion in preventable healthcare spending in the US every year. We do this by partnering with people like Frank. Frank is the head of medical management at a large health system. Due to recent changes in healthcare policy, health systems like HealthCo now get paid bonuses to provide quality care at lower cost. And it's Frank's job to save money while taking care of his patients. Like in most industries, HealthCo's population follows the 80-20 rule. That is, 20% of patients produce about 80% of the cost. And Frank knows that he needs to focus on that 20% of patients with chronic conditions like diabetes or hypertension if he really wants to make an impact on the bottom line. But Frank also knows that most of the long-term health improvement of these patients happens at home. So Frank created care management teams to call these patients on a daily basis and try to get them to engage in their health. But it's expensive and awkward to call them frequently enough to really make an impact on their long-term health. And what Frank really needs is a way to motivate these patients to engage in their health on a daily basis. And that's exactly what Wellth does. Wellth provides high-value financial incentives through a mobile application and targets these towards patients with chronic conditions. It does this by offering incentives to motivate patients to take daily actions that can allow us to measure how well they're engaging in their health. We do this through a web and mobile application that allows medical managers like Frank to design incentive programs targeted towards these chronic diseases and deliver them on the mobile phone. Let's jump over to the web demo, take a look at how this works. So when Frank logs into Wellth, he wants to create an incentive plan for his diabetics. Wellth has already identified characteristics about HealthCo's patient population by using smart algorithms on their patient data. So when Frank logs in, he can simply select diabetes from the dropdown, and he's already filtered to the population that he wants. He can see the cost, and he can even see how dragging the slider for this health parameter affects the cost of his patients. And Frank knows that for diabetic population, good blood glucose management can significantly reduce the cost of care and make patients healthier. So Frank wants to create an incentive plan to target those diabetics and to incentivize them to track their blood glucose on a daily basis. Frank also wants to create a reward for those patients if they hit quantifiable health improvement after a period of time. And they can prove that via a regularly scheduled lab blood test at their doctor's office. So let's jump back to the slides to take a look at one of Frank's patients, Sue. Like most of us, Sue sits more than she should. She doesn't always remember to take great care of her health. Sue is a type 2 diabetic, and she's recently been prescribed medication for her high blood pressure. Sue knows she should manage her health better, but she's not always sure how to. She gets an email from her health system telling her about Wellth, and she decides to give it a try. Well, let's switch over to the phone to take a look at how this works. When Sue logs in, there's 3 incentive plans already waiting for her on the phone based upon her patient data. Wellth delivers Sue daily reminders via push notifications to take simple actions, like entering her blood glucose meter readings into the phone. We record that data, and we can show her how her results are trending so she understands the impact on her own health. We also remind her to take her medication every day, and she can prove to us that she has remembered to take it by taking a picture of the pill in her hand before she takes it. When she submits this, she gets a daily incentive payment, so she's getting immediate feedback about the healthy action she's taking. And after 6 months, she goes to get her blood test, and she sees that she's got a great result, gets a strong incentive payment, and she can choose between receiving a check and deducting the payment from her bill in order to cash out. Let's go back to the slides to take a look at how Sue's doing. Sue is healthier and wealthier, and she feels great about the experience that HealthCo offered her through the Wellth platform. And Frank is happy too. By providing the right incentives to the right patients, Frank has saved HealthCo $20 million this year. He's going to get a great bonus, and he can sleep soundly knowing that he's helped HealthCo's population become quantifiably healthier. And Wellth's not just focused on diabetes. We also focus on high blood pressure, on congestive heart failure, and on asthma or COPD, the other most costly chronic conditions. And at Wellth, we're focused on results. We partner with health systems for data integration so that they can provide our mobile application directly to their patients who understand the direct financial benefit to them of engaging with our platform. And at Wellth, we're extremely focused on results here. We take a small subscription fee from our customers, the health systems, but our primary revenue source is a percentage of incentives paid out. And since we only pay out incentives when members or patients become quantifiably healthier, we're really going at risk with our customers, and we only succeed when they do. Wellth is excited to announce that we're launching into private beta, and we're looking for forward-thinking ACO health systems to join us in being the first to roll Wellth out to their medical managers and patients. We're here to bring the world better health and better wealth. For more information, please check us out at wellthapp.com or come see us in the Startup Alley. Thanks very much.
All right. Judges.
So I think, first of all, this whole kind of consumerization of healthcare is a big opportunity. There's a lot of opportunity to leverage the tools, the wearables, everything like that. A key question I have with your model is with regard to kind of a chicken and egg problem of having to prove that there is actually cost savings or health savings to enable there to be that pool of funding to then pay back to these individuals. So, tabling for now the adoption and usage by the users, how do we convince the healthcare users first to buy in and set aside those funds?
Yeah, and that's definitely the problem that we've been focused on most right now. We have a couple approaches. One, we're partnering with wellness providers, traditional corporate wellness providers, to roll that out to some of their corporate customers so we can show the impact there. Our long-term goal and what we're really looking for right now is an anchor payer client or an ACO health system who's willing to try this on some small segment of their member population. We could potentially even put up some of our own money to sort of fund, take the risk here, since we really believe this is going to work and impact health.
Yeah, I think just one quick add-on. I think it'd be really helpful to get some of those data points, whether it's tested out, self-fund that, but to be able to find out, are we actually able to move the needle so that we can use those data points to then bring it to those potentially paying clients.
Absolutely.
So I totally agree with Noah. This could be a big market, and I agree with every reason why this should exist. My biggest fear is that it is so hard to get these patients to log in their information, and I know that $900 is a lot of money. How did you come up with that, and have you seen the patients actually following through for an extended period of time with this to get that money? Have you seen that yet?
So basically, the way that it works for us is that we're providing the financial incentives for every single action when people take the actions, and so that's really the most efficient way. That's the most successful way to push people to continue building those daily habits. Like what we talk about in terms of behavioral economics is called tiny habits. So the story we always tell is that the tiny habit is if you want to floss your teeth, you should actually start by just every night you floss one tooth, just one. And then the next night, after a week, you're going to do two. And so it's really building those tiny habits to make something long term. And that's where we think the success is going to be for us, by rewarding each people when they just do one thing, like just track, for example, for diabetes, just track your blood sugar just one time, and then rewarding you every time to build that up.
Okay.
How do you deal with, this is going to sound awful, but how do you deal with fraud? People putting in data that's not, taking a picture of a pill or, and then the flip side is, how do you deal with people who are doing everything right, but they're not actually getting an improvement in their health, so they become discouraged?
Yeah, and I think that there's two components there. So on the fraud side, we kind of assume that part of that is just going to happen. There's probably going to be maybe even 10 or 20% of the users that it's not quite right. They're taking a picture of their sister's pill or whatever it is, or they don't take it after they take the picture. We believe that we're leaving enough room in our actuarial models to know that given these financial incentives, you're still going to see an overall financial benefit, and that the users who do stick with it are going to see the health impact. The other side was about, you're talking about the
For people who are doing everything right and they fall into that 20% high cost category, but for whatever reason their makeup, it's not having the same impact.
Well, that's really a minority, actually, of the patients that we're looking at. We're looking more at people who are have a really specific chronic disease, where just managing those daily actions is the most important thing that they can do, and just keeping the majority of the people on track with that is going to be enough. Like a lot of the time it's that people forget to take their pills, so that's why we have the medication adherence part as a major factor. A lot of times you have people just not complying with what the doctors say. That's why the number we showed, the $500 billion, is what is actually preventable, manageable diseases, manageable portion of the healthcare system that could already be improved if everyone was necessarily doing the things that they were supposed to. And it could be an educational component as well. Just knowing and having those notifications come right to their phone.
And a really important part of what we're trying to do is to have these measurable improvements. And so if we see that there's not improvement happening, we're still integrating back with that care management team at the hospital. They can reach out, they can call, they can do the in-depth follow-up. But what we want to be is that kind of in their hands daily solution to ensure that they're at least taking the steps that they need to take.
Right, reminding them what to do when they're not with their doctor anymore.
Now, you said at the end you're looking for a few forward-looking, forward-thinking, healthcare, big companies. I mean, that's your sales strategy, to sell to them?
So, yeah,
and are there forward-thinking ones, and how many do you think there are, and what kind of dependency do you really think that is?
Yeah, and so that's obviously not our only kind of path to market, but we think that that's the best way to get this into the hands of users. We're trying to capitalize on a big shift in the healthcare industry, which is going from fee-for-service to fee-for-quality. So what we're seeing right now is especially with Medicare ACOs and more following that with commercial ACOs, they really are incentivized to implement these solutions, and there's a lot of emphasis on their innovation departments actually getting new solutions in there. So there's hunger for this kind of thing. It's obviously a really long sales cycle. We have to go through all the compliance. We're going to be taking in PHI, and so we have to be HIPAA compliant and cover all those bases. But we're putting our efforts in, and we're going to do that.
Any other questions?
What do you think of the name? I mean, at first I was like, I don't know if I like this name, Wellth. It sounds like Wealthfront maybe, but it's a healthcare. Then I was like, oh, wealth, health, health, and then you get money back, so it's wealth. So then I liked it. What's the feedback been of the name? Do you think? It's really hard to get the name right. I mean,
yeah.
Great companies like have names that kind of probably sounded dumb at one point, and now are like amazing. So, what do you think? What has your thought process been on that?
We find that people usually like it. It kind of clicks because it's the health and the wealth. And when people get it, they're like, oh, I get it. I like that. Right. So,
Portman
like
awesome. All right, that was Wellth. Thank you guys so much.
Thanks very much.
Thank you.